Hi, Alan Mitchell, Mitchell Chiropractic up here in Magnolia, and today we're going to be talking about stabilization of the shoulder girdle. Now, when you look at the function of the shoulder, there are three large groups of muscles that have to work together for the arm and the shoulder to function in a normal way. You have the large prime movers of the arm, the bicep, tricep, and deltoid. You have all the muscles that move the shoulder blades around, and then you have the rotator cuff muscles, which come from the shoulder blade to the front of the shoulder and have a lot to do with the stability of that joint. Well, the rib cage is a fairly oval structure, and you can think of muscles kind of like a rubber band. In order to stretch a rubber band, you have to anchor one end from moving so you've got something to pull against. If both ends can move, you can't stretch the rubber band. Muscles work exactly the opposite. You have to have a stable origin or base against which you can pull in order to do work. Again, if both ends move, the muscle can't do its job very well. Well, the rotator cuff muscles specifically anchor from the shoulder blade and hook to the front of the shoulder. And if that shoulder blade isn't setting firmly against the rib cage wall, then it has kind of a weak base. Well, because of the nature of the shape of the rib cage, as the shoulder blade begins to climb, it comes in at the top and it comes out at the bottom. And you can see evidence of that as this starts to come across here. On a relative basis, if we can bring the shoulder blade into a much lower position, then it firmly anchors that blade against the rib cage wall, giving a much stronger foundation on which you can build power and performance through the shoulder.